on this program are not those of intellectualradio.com, its subsidiaries, or sponsors. Encouraging, educating, and empowering you into action. This is Warriors Talk with your host, Lady Reshell.
Hello, hello. Welcome to Warriors Talk with author and founder Lady Reshell, where we move away from awareness towards action. It is Health and Wellness Monday, and our topic for today is mental health and its effects on your physical health. We are live on Intellectual Radio. We just heard from The Drive at 5 with Roman. Keep it locked right here on Intellectual Radio and allow us to feed your brain. On the last episode of Warriors Talk, Reshell and I talked about stages of a rebound relationship. Go to YouTube and type in Intellectual Radio, stay connected for any episodes you may have missed. The quote of the day is, "There is hope even when your brain tells you there isn't." We are grateful for our sponsor on today. We have Pastor Michael Richardson with the Emanuel C.O.G.I.C, who has a special message for us.
Greetings, I am Pastor Michael Richardson.
And I am First Lady Anastasia Richardson from the Emanuel Church of God in Christ. We're located at 3058 West Van Buren in Chicago, Illinois. We are building upon a solid foundation.
And we're inviting you to join us every Sunday morning on Facebook Live at Emanuel C.O.G.I.C at 10:15 Central Standard Time. And you can also view our videos on our YouTube channel at Emanuel C.O.G.I.C-MR. Once again, this is Pastor Michael Richardson
and First Lady Anastasia Richardson, and we're from the Emanuel Church of God in Christ. We are building upon a solid foundation.
Here are your trending topics for today. 10 people were killed and 3 injured during a mass shooting at a supermarket on Saturday afternoon in Buffalo, New York. 11 of the 13 people shot were Black, officials said, and the massacre is being investigated as a hate crime by the Justice Department. In a 180-page diatribe, the 18-year-old suspect allegedly detailed how he has been radicalized and described the attacks as terrorism and himself as the white supremacist. He was arraigned on first-degree murder on Saturday and was previously investigated in June of 2021 for making generalized threats while he was in high school. Those are your trending topics for today. If you are joining me on any form of social media, please like the show, share the show, invite someone else in on the show that you feel may benefit from this valuable information. Joining me today is none other than our healthy solution expert with over 20 years experience as a family physician, and she is impacting lives every day. Hello, Doc Michelle.
Hello, Lady Reshell. Hopefully you can hear me clearly. How are you this Monday?
Good. I can hear you loud and clear.
Good.
I'm excited about this topic today. May is Mental Health Awareness Month. And this topic is so very much needed today with everything that's going on with the pandemic and what happened in New York.
Yes. I'm glad we're talking about it. We should be talking about mental health a lot more than we do. We just focus on it in May, but you are so right. There's so many things that are, quote, stressing us out from, what you mentioned, from the pandemic, financial stressors, all these things. Moms can't find formula. There's a lot of things going on that really you feel like, oh, I just need a moment. I need to take a deep breath and center, right? So I'm glad we're talking about it. I hope we can help someone listening today and get them the help they need.
Yes. Our topic again is mental health and its impact on physical health. And the link between mental and physical health is often misunderstood. They're often thought of as separate entities, but the two go hand in hand. In fact, the World Health Organization states that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmities. So let's just jump right into that conversation.
Yes. And so, right. We talk about total wellness a lot on your show, right? And we want to highlight mental health because it really does play a part in your physical health. And just to give some statistics, right, from the National Association of Mental Illness, 1 in 5 adults experience mental illness, right? And since the pandemic, we think that about 50% of adults actually feel some sense of mental illness, disturbance, depression, anxiety, or worse. And so it really is so imperative that we address it from the mental health side and from the physical side. 1 in 20 adults have serious mental illness where they need hospitalization or medication. And still, there's a stigma that goes along with mental illness, but we know that there are many different factors that lead to the expression of mental illness. Some of it is environmental, some of it is genetic, right? We know that as well, but we just want to highlight it and let people know that there's help available. And even when we talk about the young adults and the youth, right, they tend to suffer in silence. 1 in 6 youth or young adults have had a major depressive episode. 3 million have thought about suicide. And I just saw a statistic, I think was on the CDC website, that there's been a 60% increase in rate of suicide from 2007 to 2018. And that suicide is the second leading cause of death in that adolescent to young adult age behind accidents. So we just, we want to talk about it. We want to make sure that people don't feel the stigma, reach out for help, and then talk about what does that mean for your physical health and your total well-being.
Because we do know that there's a link between physical and mental health. And for some reason, we focus on the physical health all the time, and that mental health gets left out or neglected until, something boils over and you have no choice but to address it. But you should be treating it just like you treat your physical health. You go to the doctor once a year for your annual, unless something is going on. You should be checking in mentally as well.
Yeah, and we know some of the things, the ways that mental health can affect your physical health. There are many. So we know that when you are feeling depressed or stressed or have a mental illness, that your sleep is disrupted, for one thing, right? And we've talked many times on the show about the importance of sleep, that we should be getting 8 to 10 hours ideally. And a lot of us don't get that. We either have insomnia or we have sleep apnea, which there can be a link between mental illness and sleep disturbance. And so when you're lacking that good sleep, we've talked before, it increases inflammation in your body. That stress, it's another stress to your body that can lower your immune system, which then puts you at risk for other things, right? Infections, even things like cancer, so that's also important to pull out.
You mentioned sleep, and I know I don't get enough sleep. I already know it. I think my body is used to getting probably no more than 6 hours. If I'm sleeping longer than 6 hours, my body automatically wakes up because that's what I'm used to getting. And I know that when it comes to sleep, I could do so much better. But yeah, it's a process for me.
And they get used to sleeping 3 or 4 hours, but we know that when you don't sleep, if you're stressed, if you're suffering mental illness, you're not sleeping well, then that also can cause high blood pressure, decreased concentration, poor balance, lots of other things that can happen from that poor sleep. So we want to be sure that mental illness, disorders like depression and anxiety are getting treated and getting managed.
And I think people think, well, I could just make up the sleep. I'll sleep longer the next day, but you can't make it up. I mean, once you miss it, you miss it.
Yeah, because once you miss that restful sleep, we've talked before about the cortisol level and the inflammatory things that happen in your body just from that. And we know that chronic, just not getting sleep day after day after day, it can increase your inflammatory markers, decrease your immune system, and cause these things that we're talking about.
All right, people. So we have to make sure that we are getting enough sleep. And again, I'm guilty of that because I know that I don't get enough sleep. What else could be affecting us mentally and
Right.
physically?
Yes. So we know that people who have mental illness are also tend to be smokers. Studies show that more patients with mental illness can smoke. And because some mental illness is related to low dopamine levels in your system, right? Dopamine is the feel good hormone. And when you smoke, you get sort of a chemical dopamine feel, right? So you use your smoking because it's relaxing, it feels good when they smoke, right? And so it becomes a vicious cycle because the dopamine that is sort of created when you smoke is short acting. So you feel good, then you don't smoke, then you're like, oh, I felt better when I was smoking, right? We don't think about that. Smokers out there, pay attention to that, right? So what we want to be sure, because we know smoking leads to other things, right? Heart disease, for one thing, and cancer. And so we want to be sure that we know that if you are a smoker and you have mental illness, you tend to smoke more than if you don't have mental illness. So again, that's a correlation between those two things. And they've even done studies, Reshell, that show that people who are in better fitness shape tend to feel better. We've talked about that, right? That when you exercise, you release natural endorphins that make you feel good. So when you're not exercising and you're not getting that, you're not exercising. So now you may be obese, which leads to these other medical conditions like diabetes and heart disease. And people who will feel depressed or have schizophrenia or bipolar or any other mental illness, they may not have the motivation or energy to exercise. So it becomes sort of a vicious circle, right? The fact that they're not exercising leads to obesity and other sedentary lifestyle things. And we know that if they were able to exercise, they would release those natural endorphins, which would make them feel better in general.
So exercising is one thing that you can do that would help you with mental illness if you're dealing with it. I think sometimes we take things for granted, just things that are right there at our disposal that we can use. And you really don't even have to go to the gym to really get the physical exercise. We know walking is very beneficial when it comes to many diseases that are out there. And just taking advantage of a 15-minute, 30-minute walk. And it's nice outside right now, so we have no excuse. So
Right.
I'm not a walker per se. I would rather exercise than to go walking. It just seems so slow to me. Like I feel like I
Yeah.
have to be really doing something, and I feel like I'm not accomplishing anything with the walk. But that's just me.
Yeah.
Once you build up past that, your endurance past walking, then walking doesn't do it for me.
Right. But we know that people, if you start a walking program, so if you're not exercising at all and you just start a walking program of walking 30 minutes per day, there are great benefits. You start to lower your blood pressure. You start to get that endurance, so that you can get a little bit further and get that weight management. But not only are you, lowering your blood pressure, we know, especially if you're walking outside, the vitamin D from the sun helps to lift the spirits as well and release those natural feel good hormones. So now that it's better here in Illinois, I encourage everyone, me included. I have been outside as much as possible, because you feel better when you get that sun on your face, and the sun and the vitamin D actually does help.
Because we know for African Americans, the vitamin D with our skin, it takes a lot really to penetrate through our skin. So the more we could get out there and get it, especially if we're not getting it any other way, then I
Right.
said take advantage of it.
Absolutely.
Take advantage of it. Okay, so we talked about sleep. We talked about exercise. I want to talk about, we talked about smoking. So smoking, would substance abuse kind of fall into that realm of smoking?
Well, with mental illness, there is a correlation that people who have mental illness have a higher incidence or prevalence of having a substance abuse disorder as well. And so it's important that when patients are being managed for their mental health, that we also take care of any substance use disorders. That may be prescription opioid or narcotics, that could be illicit, drugs, cocaine, heroin, anything like that. Alcohol, if you're abusing it, that's a substance use disorder as well. And so because if you are struggling with that mental disorder and you're feeling that pain of that, right, you use these substances to sort of feel better. And then it makes the mental health issue even worse, right? And so it's important to address both things. And we make sure that we do that in my position, that if you have a substance use and a mental health disorder, we make sure you're connected to the right resources to address both of those.
It would scare me, especially if I'm on some type of meds for the mental health and then I'm using some type of substance. Like, yeah, you have to be careful with that.
Yeah. And we know that speaking of medications, right, when you have a mental health illness, you are more likely to not be consistent with your medications, be it your psychiatric medications or your diabetes medications, any thyroid medications, any of those, right? And so that alone can make that disease progress further, because they're not being consistent with the treatment options that they have for their non-mental illness diseases.
What about these people that take themselves off of their meds? Like,
yeah,
I've heard people say, oh, I'm not taking those. They diagnosed me with bipolar and depression and anxiety, but I'm not taking those meds because I didn't like the way it made me feel. So I just took myself off of them. And I'm just like, what?
Right. Well, we know that, you should always talk to the provider before you take yourself off of any med, because sometimes you get rebound symptoms, right? What was being controlled now becomes even worse if you abruptly stop those medications. There are many antidepressants. If you just stop it abruptly, you can have worse depression or feel anxious from it. We usually, speaking of medications, want someone, if we start a medication, to be on that medicine for at least 6 months. And then if they feel they're connected with other supports, a counselor to talk to, their physician, they can be weaned off of those medications, right? There are times where someone has an acute issue, right, that causes them to feel so depressed, right? Maybe it's grief and loss. Maybe there's a particular stress that has caused them. But some people need to be on those medications for life, and that's okay. And if you are on a medication and you feel that the side effects are intolerable, you can't take it, talk to your provider. There are so many great options for all those mental illnesses: schizophrenia, bipolar, depression, anxiety. All of them have great options. And so if one doesn't work, another one may.
You mentioned something, Doc, about people that may be dealing with like diabetes or some other type of illness that's taking medication. And I know when I was dealing with cancer, I thought about, the doctor never talked to me about the mental side of it. Like they never, like when you diagnose somebody with this life-altering disease, I would think like you would say, okay, we're going to start the treatment, for the cancer, but we also are going to start, your counseling alongside of it as you're going through this treatment, because some people, it's devastating for some people. And people do get depressed when they're going through, whether it be you just got diagnosed with diabetes or high blood pressure, you just had a heart attack, you're diagnosed with cancer. Like, that's a life altering diagnosis, and then you're sent home to deal with it.
Yes. Two things there. We know that depression can be more prevalent in cancer and heart disease patients. And providers what should be happening is a depression screening test, which can be as simple as a 2-question questionnaire to answer. And depending on the results of that, then they can go and do a little bit deeper questioning of you. But many times, some providers don't address that, but it's very important that be, especially when you have a chronic illness, that be part of the normal sort of intake, health screening that we do, as we do everything else for diabetes and EKGs and everything else that we do. Because if a provider doesn't bring it up, sometimes the patient won't bring it up, right? Because they feel the stigma and they don't want their provider to know that they're feeling that way. So a lot of times they won't bring it up unless we ask the question.
Yeah, and then I may feel like that may not be an issue. So I mean, this sister doctor didn't ask me about it. I'm not gonna bring it up because
Right.
that may be opening up a can of worms. And so,
Right.
that's just another thing that I have to deal with. So you feel like, the cancer is physical. So I think you feel like you could deal with that better than the mental.
Yeah. And you make a good point, right? If my doctor didn't bring it up, it must not be that important, right? It must not be something they want to talk about. So, for the providers out there that are going to hear this, I say, ask those questions, open that book of worms, as we say. And I would usually say to patients, would you say most days out of a week you wake up feeling happy or blue, right? Do you find that you don't do the things that you used to enjoy as much as you used to? And so that's the questioning is different than to ask someone, do you feel depressed? Because most people are going to probably say no, there's a stigma, they don't want to admit that. But if we can ask it, and even if, just for anyone out there listening, if you are around a family member or friend and you feel that person may be suffering with depression or anxiety or something, ask the question. Yeah, I'm concerned about you. Do you feel, like you're worried a lot? Do you feel pretty happy with yourself? How do you feel most days? And if they're sort of hesitant or not, or you're concerned, talk to them about resources that are available to them. Providers tend to be the first line, right? That doctor they're seeing pretty regularly, because we can talk to them about we can do the depression screen, we can prescribe medications, we can help you find a counselor or a therapist that's in your network, show you how to do that, so you get the help to talk about it. Because most people, I would say all people, could benefit from talking to a counselor or therapist, right? We all have experiences in our lives that may cause us to feel depressed or anxious, or if you have a serious mental health condition like schizophrenia or bipolar, in addition to taking your medications, you want to be able to talk about how it is to live with that disease. What are your struggles, and what comes easy, what comes hard to you. So very important for us and the provider community to address it.
Yeah, very important. I remember when I had my last baby, I remember going in for my checkup, and my doctor had this piece of paper and she was asking me a series of questions, about mental things to see, if everything was going on, like they should. So I do remember that. I only remember her doing it. I don't remember doing it with my other kids. And I don't know if it's because with her, my relationship with her was much tighter, I guess, or it could have been that I communicated more with her about what was going on in my life. So and she was triggered to say, okay, let's see how she's doing mentally. So she did, do the test.
Good.
And then she asked me after the test, like, how would you feel if we put you on, some sort of meds or something? I was like, I'm okay. Like, no, I don't want to, so, and she respected that, but she did ask. So I can say she did, took the time to ask me those questions, because I did open up to her about some stuff. So we have to be open and we have to be honest with the people who are supposed to be caring for us and recommending stuff for us. And, because if you're hiding the stuff or omitting the stuff, it's not helping. It's not going to help you in the long run.
Yeah. And most people who have mental illness do not talk to their doctors about it, and they suffer in silence, right? And it is a two-way street, right? We have to be able to feel comfortable talking to our provider about it, and the providers have to feel comfortable, really addressing it and getting the resources for them. And just one point about the depression and mental illness not only affects the person, it affects the family, right? It affects, because a majority of people who have mental illness have a caregiver that does something for them. It might be taking them to an appointment, picking up their prescriptions and things like that. And so it affects more than just the individual. So it's important that we recognize that, right? If you're the caregiver of someone out there and you feel, stressed, we'll talk about what can you do to feel better and have a better sense of wellness for yourself as the caregiver and for the person as well.
Yes. So I have a 15-year-old that's a type 1 diabetic, and she came to me and she says, Ma, I want to talk to a counselor.
Mm.
And then I was like, what? Like, why you wanted to talk to a counselor? But, she has to deal with this disease, and she has to take the medicine and give herself shots every day and, worry about carb counting and all of that. And sometimes she does not want to say anything to me because it may seem like she's complaining about it or whatever. So I just set her up with the counselor, and she talks to the counselor. They only talk once a month. So the counselor said if she needs to talk more than that, then they can set it up like that. But I did it for her so that she can get some type of peace of mind, because it can be depressing at that age. She was diagnosed at 11. So it could be depressing having to deal with this. And especially if you're on the internet reading about what it does, what it could do, it could be depressing, it could be scary. And I didn't want her to be afraid to come to me to say anything about it when something was going on, or to just be open, just to get it out so that she wouldn't have to carry that burden by herself.
Yes. Well, kudos to you for listening to her and meeting her where she was, right? We don't want to ever sort of negate when someone says something like that. It's important to just be open and receptive and listen. So that was great. And getting her the help that she needed, just to know that she can talk to someone. That's not necessarily her mom, and that's okay too, right? That can help her really see things differently, think about it differently. I always say that, therapists and counselors, they go to school and college to do what they do, right? They have better, different techniques, different ways to get you to open up, to get you to think about things. And so sometimes we may just get our information from the internet or friends or so, but they're not the expert to really help you through that. And so that's where a therapist or counselor can come in. They can just help you if something is seeming overwhelmed. They can help you look at it differently and think about it in a way that's not so overwhelming to you, give you tools to handle it. And I'm
Yes.
sure that's helping your daughter, because we were saying that 1 in 3 young adults, and this is 18 to 25, experience mental illness. And so if that's 1 in 3, we probably know someone. Now, we may not know we know that person, right? They may not be telling us about it, but it's important to be supportive and know that just as diabetes and other physical conditions are prevalent, so is mental illness.
I totally agree. We're going to take a quick break, and when we come back, we're going to talk about mental illness and the church. And we're going to talk about my sponsor, who is Paula Kelly with Allstate. And she is a cancer survivor. She's an African-American business owner, and she's located at 327 East Glenwood Lansing Road in Glenwood, Illinois. She could be reached at 708-758-3300. And she has been sponsoring the show, I want to say, probably the last 3 or 4 years. She has been sponsoring the show. So I am grateful for her. We are live on Intellectual Radio with Doc Michelle, and she is always spitting some gems about mental health and how it impacts our physical health. And we did have a question by Walter. And hey, Cadillac, by the way, Cadillac is joining us. He says, hey. We have a question by Walter Jones. He says, why is there such a taboo to mention mental health in the church? And second part of his question is, do you work with pastors?
So the first part of the question, it's really about sometimes in churches, we are focused that there is a higher power that really is in charge of everything, right, in our lives. And even I've had patients who will tell me personally that they don't want to take medication because God's going to heal them. And they don't want to talk to anybody because they have their pastor or someone in the church to help them through. And that is great. I always say, continue to do that. However, as we just talked about, Reshell, pastors don't have the specific training to deal with serious conditions, the techniques and the support that a clinical counselor therapist can provide. And I also, and I've had this conversation with patients before, that God put me on this earth to be educated, to help my community, to help you, right? He blessed me with these talents to do good with. And this is how I'm going to do that, right? I'm going to educate you. I'm going to, if we need medication, that's okay too, right? If we believe that God is in control of all, then he's also, helping to get these medications that are life changing and life altering. Chemo, right? Chemo is a toxic thing, but it still saves lives, right? So we have to look at both pieces, right? You can't, I remember too, just an aside, that someone in the church said to me, why are you getting the COVID vaccine? Because don't you have faith? Right, that God's going to heal you. So I said, well, I do have faith, right? But I also have faith in the people, because God put them in the positions to give us this information, right? And as a scientist, as a medical doctor, of course, right, I'm coming from a different place, but you can do both is the point, right? You can still talk to your pastor. You can still get all that healing, from talking to God and reading the Bible and all of that, because it has helped me too. But we also know that with mental illness, if someone needs medication, there are some chemical imbalances in the brain that cause that expression of that mental illness that need to be corrected with medications. And both things can be true.
He says, amen. Thank you for saying that. And then he says, yes, exact words that I use.
Awesome.
Do you find
and
that?
I haven't.
Go ahead. No, go ahead.
No, I was going to answer his second question. I have not talked to a lot of pastors about it. I'm more than welcome to do that. I've talked to pastors who are my patients when we're talking about medications. But yeah, but it is something we have to address when you say that, right? Mental illness in the church, and we have to provide all the resources available, and understand that both things can be true. And if you talk to a counselor or take medications, it doesn't mean that you have any less faith in God. That's just my opinion. And I'm sure others feel different.
Do you feel, Dr. Michelle, that it's a cultural thing when it comes to that, when it comes to, the mental health side of it?
Yeah, well, I mean, in our community, we know mental health in the African American community, there is a great stigma. There's a stigma overall, but there really is a great stigma because there is the sort of thinking that um, religious or spiritually, right, you can pray it away. Something's wrong with me if I have a mental illness, right? And I don't want to tell someone who might look down on me, especially if it's someone in the church. Sometimes we're not talking about it because we feel maybe we might not get the best reception, right? But there is more of a stigma in the African American community. We have to address that as well because people are suffering in silence. If I tell you 1 in 5 adults, right, and we talked about it at the beginning, if I said 1 in 5 adults have a mental illness, be it depression, anxiety, schizophrenia, or bipolar, we all know someone, right, that is living with a mental illness. We know somebody at work, at the church, at the school, wherever we live and work and go, there are people with mental illness. And so it's important to know that everyone is struggling with that on some level. If it's not them themselves, they know someone, they know a family member or a friend. And what is the saying? Everyone has a struggle we know nothing about, right? And so we're just going to be nice to everyone and treat everyone, with respect and understand that, let's be a support and help people and get out of that sort of suffering in silence thing. If you need to talk to someone, talk to someone. If you want to start with a provider in the office, do that, right? And it can get you to the right place.
Yeah, speak up, speak out so that
Speak
someone
up.
can hear you. Yes. Talk about, Dr. Michelle, the longevity of having a mental illness. And I read somewhere that it decreases your life expectancy because of how taxing it is on the body.
Right, right. So mental health, because we know a couple of things, right? When you're living with a mental illness and poor mental health, that's a stress to your body. That stress releases cortisol, inflammatory markers in your bloodstream that can lower your life expectancy because all those things in your body um, can cause other diseases, right? Not only is it just causing inflammation in your body, it can lead to the effects of other chronic illnesses, as we talked about, diabetes, heart disease, cancer. And so, yes, and things that we know help and lower your stress level. Also, we know has great effects on how long and the quality of your life, right? Eating healthier, meditation, yoga, exercising. We know that that helps improve your lifespan if you do that on a consistent basis. But yes, mental health for many factors, many things, right? Not just that the inflammation that it does, but it's in many patients, they're not taking care of the physical, the diseases that they may have, right? They're not as consistent. Because even for people who don't have mental illness, right, it's hard to be consistent with a treatment plan for your diabetes or your high blood pressure and eating your low cholesterol foods and all those other things, right? And so you can imagine that if you add mental illness on top of that, it's hard to manage those things, which then in the long run is going to lower your lifespan.
Talk about lowering your lifespan. What about lowering your libido?
Yes, yeah. Well, we know that that can happen too with mental illness because sometimes the medications that they take, that can be a side effect of some of the medications. But we also know that there are things that can help to maintain your libido like we always go back to food and exercise, right? Those things are important because in inflammation, not only libido, but like erectile dysfunction, right? If you are depressed, if you are eating the wrong foods, all of that will play a part in libido and function. And so, and again, the medications too do have some side effects, but again, there are different ones that you can talk to your provider about.
Yeah, I also read something about eating a lot of processed food too, plays a role into it too. Like certain things we just don't know because we wasn't taught. So, just
Right.
things that you put,
Health,
in your mouth.
yes.
Yeah,
Healthier eating, healthier lifestyle. Um, It helps us to feel better. Eating processed foods, we don't know what's in them because they're processed. And we know they can weigh you down, right? Versus fruits, vegetables. I always talk about the Mediterranean diet, fruits, vegetables, nuts, things like that, that come from the ground as much as possible, is better. They have anti-inflammatory properties. So very important to, as much as possible, incorporate that. When people have serious mental illness, though, right, they may not be eating the healthiest, they may not be cooking their foods, they may be getting a lot of fast food. Um, but providers, they are, depending on their insurance plan and how old they are, they can get delivered meals that may be better for them. Talk to a nutritionist to get some of those sort of cues on what are the healthier eating options. But in general, as we always talk about, right, the foods that have fruit and have color, those fruits and vegetables with those bright purple, yellow, oranges, all of those colors are the anti-inflammatory properties of those fruits and vegetables. You want to add those to your diet.
Let's talk about suicide as it relates to mental health. I was thinking about some of the celebrities who have passed away, and most recently was Naomi Judd, the country singer who actually shot herself. And you would think, I heard Taraji Henson said, just because you have money and just because you have the fame, it doesn't mean that you don't have issues going on, and the money can't take it away. And when I thought about it, I'm like, oh my goodness, like she actually shot herself. And normally the men are the ones who use the weapons like that because they know that it's going to get done if they use it, right? Women, we may use a knife or take pills or something like that. So she had to know that if I'm using this gun, I'm going to get results with it. Like, so yeah, that kind of shocked me too, because I know that men are the ones that normally use the weapons that are going to get the job done.
Right. Yeah. Yeah. Exactly. Men tend to use the ways that there's no coming back from, jumping off buildings, shooting themselves, things like that. Women tend to not do that. Right. It's usually, like you said, pills or something else. But um, yeah, we know that suicide has increased over, as I said, over the last 10 years, right? There's been a 60% increase in the rate of suicide from 2007 to 2018. And even when patients take medications, if they're not well well managed, because sometimes what will happen, we talked about before, right? They felt good and then they kind of stopped it, or took it every other day, or wasn't consistent in their therapy sessions and things like that. And they continue to feel horrible, right? And we know that people who have such serious depression, they feel no other options available to them. But I can't speak to those particular cases, but we want people to be sure that if they are suffering, if you know someone who you feel like things aren't quite as stable as they once were, right? That you take action to help them as much as you can, right? It's hard with adults because you can't force an adult to receive help, right? If it's a minor, you can. But once they become 18 or over, someone can decline help, they can leave, unless they're committed to an inpatient situation, they can leave therapy, not take medications at any time. But because there's, even with the pandemic, there's such a rise in these mental illness and people are feeling so overwhelmed, we have to let people know that there are resources available, that if what they were taking medication wise wasn't working, there are other options, right? And we know that some patients have such severe illness and symptoms that they need multiple medications, right? But they have to also want to take those medications, right? Because what depends on what the side effects are. Maybe they don't want to take all those medications, and so it becomes sort of a vicious sort of cycle, right? Because we need to acknowledge when we see that someone could be suffering, we want to get them the help. We want to make sure that once they're in treatment, that if they even start to feel, worse, that they know what to do with that, right? Who to contact, have an emergency contact. Sometimes it means, depending on the age of the person, if they're an adult, like, do they have a power of attorney for healthcare, right? So if they're not capable of making decisions for themselves because they're incapacitated from their mental health, can someone else make decisions for them, force them to get treatment, to get inpatient treatment, things like that. There's a lot of nuances to it when you talk about if someone is seriously in a situation where they are not making good decisions, right? They're not getting the treatment that we think they need. If they're an adult, there's not a whole lot you can do about it unless you are already their power of attorney for healthcare and can make decisions for them. And they have that in writing. That's another step if you know someone. And that's usually, the mentally ill person has to agree to that, usually when they're in a better state, right? If it ever comes to the point where you feel like, you're not able to make decisions, you're not feeling good, I need to get you admitted. Am I able to do that? But they have to put that in writing already.
You have people, Dr. Michelle, they're functioning inside of their mental illness, right? They get up, they go to work every day, they're living life, but then when they go home, everything else is dark, is dim, and they're shut off from the rest of the world. I was thinking about the former Miss USA. Her mom said that they would FaceTime every morning. Like, every morning they would talk and laugh and everything. And she knew that her daughter was suffered from depression, right? She said in the public, she lived one life, but then when she got home, it was totally different, right? She was depressed and she was battling that depression. When she ended up jumping off of her building in New York City and killing herself and leaving a suicide note, for her mom. Another young lady was in college. I think she was a freshman in college, and she ended up taking her life, and she actually left a note. She left it on Facebook. And Former USA also left something on Facebook about hoping that this is a day of rest,
Right.
And so it's almost like they were kind of reaching out, but then they were at the point to where they were like, this is it, I'm giving up. But yet and still, you took the time to leave this information, I guess, so the people behind won't be clueless and to give them some sort of comfort, I guess.
Right. Yeah. And I don't know, again, I can't speak to those specific situations where if they were on medication or talking to someone, right, or trying to sort of, quote, deal with it on their own. I can't speak to that, but usually if they are surrounded with medical and behavioral health therapy, um, we can help that. We can help improve those hopelessness symptoms so they don't get to that point.
Walter had a good question. He says, if you believe your spouse is mentally ill, is there a safe way to get them help, even though they are in denial?
Right. So that is probably a situation where you may have to reach out to their medical provider. One way to do that is to, as a spouse, to say, hey, I'm concerned about my wife. Next time you see her, and sometimes you could just leave a message either with the provider themselves or the nurse. Next time you see them, can you do an assessment for that, right? And that's fine to do, right? Because again, as an adult, they can refuse, right? They can refuse treatment and medications unless a psychiatrist and their provider deem that they are incompetent to make decisions, right? But we always say that some people can make poor decisions, doesn't mean they're incompetent to make decisions, right? And that's usually the incompetent piece is a very hard thing to prove. They have to just not be able to do anything. So I would say in that type of situation, as a spouse, you should probably reach out to the provider to let them know of your concern and that they can sort of broach that, right? Because she may have a relationship with them and just say, hey, this is what I'm concerned. This is what I'm seeing as her husband and as his wife or whatever. Can you address that with her and see, what is your medical, because they have, again, more tools to we have good questions we can ask to determine if someone is depressed, do they have dementia, what's the situation?
Because I'm thinking, like, if maybe you confront them, they may get defensive and, not want to do anything. So, and maybe shut down. So yeah, that was a great answer. I totally agree.
Yeah.
Mylea says mental health discussions are needed in the Black community. So thank you for this.
You're welcome. Yeah. We need to talk about it more than once a year, right? Okay.
Yes, absolutely. I want to give out the National Suicide Prevention Hotline, which is available 24/7, and it's 800-273-8255. And that's for anyone who may need it. I mean, you just never know. They said they have techniques that will be able to help you and prevent suicide. So if you're thinking about it and you're not really sure that you want to do it, but it's in the back of your mind, and maybe you think maybe just call them and hear them out and just hear what they have to say. Because I think sometimes people who commit suicide, they're at the point to where they feel like there's no hope, that the pain that they're feeling, the only way to get rid of that pain, then to stop that pain, is to kill themselves so they won't have to feel that pain. So I would say at least just give them a call just to hear what they have to say. And you never know. It's called the National Suicide Prevention Hotline. So they're trained to help prevent people from committing suicide.
And there's also the National Association for Mental Illness, that's NAMI.org. They just have lots of other resources, resources to help you find providers, to help people that you know and what to do.
I'm sorry, she got frozen. So there's the website that Dr. Michelle was talking about, NAMI.org. And then also the suicide prevention hotline, again, 800-273-8255. If you're having any issues, any questions, if you're just thinking about suicide, or you think that you need some help, or people around you are telling you that you need help, then go ahead and just call the number, and you never know that you might have a change of heart. So I think we lost Dr. Michelle, but she did give us some great points on what to do if you're suffering from mental illness and you're having physical issues. Because sometimes when you're dealing with physical illness, you may be in denial, you may be depressed, and so you may have mental issues. And in order to have a total wellness, you need the physical and the mental part to be in alignment. Dr. Michelle, you want to give some words of wisdom?
Yeah, just piggybacking off of what you said, right? That whole health is the mental and the physical. We know that the mental can affect the physical, so we want to be sure that if you are feeling depressed or if you know someone who is, to address it with your provider, because there are many options, be medications or no medications, to help, right? Which will help you overall feel better and manage the rest of your physical conditions.
Awesome. Thank you so much. As always, you always give some great information, something that we can take action on today. So I appreciate your wisdom. Thank you so much.
You are welcome, as always.
And I will close out with my sponsor, Gloria Dotson with Mary Kay. She's catering to all of your beauty needs from head to toe. You can go to marykay.com/GDOTSON. Join me next Monday at 6 p.m. right here on Intellectual Radio. And I'll leave you with these words of wisdom. Mental health is not a destination, but a process. It's about how you drive, not where you're going. As always, thank you for tuning in to Warriors Talk with author and founder Lady Reshell, where we are changing lives one warrior at a time.
Thank you for listening to this week's edition of Warriors Talk with Lady Reshell. To find out more about Warriors Talk, follow at Warriors Talk, the number 1, on all social media outlets, and Warriors Talk with Lady Reshell on YouTube. Please join us next week and every Monday evening at 6 p.m. Central Standard Time on intellectualradio.com for Warriors Talk with Lady Reshell, where we encourage, educate, and empower you into action.